Hi, I'm Bozzi from ACMVET407A cardiac medical nursing routines. Today we're doing a diagnostic ultrasound on this dog. This dog's a 26-week-old German Shepherd. She's female and she's had ongoing cystitis. So today we're actually doing a cystocentesis on her. So we're using the ultrasound to guide us to find the bladder, to take a sample, sterile urine sample that we'll send off for culture. So I've already prepared the ultrasound machine. I've put a blanket on the table. I've gotten out the ultrasound gel, the alcohol, a long needle, syringe and gloves, and paper towel. The communication I had with the owner before this procedure was telling her to fast the patient, also telling her to make sure it has some water in the morning, and to try not take her out for a wee walk if possible. And that was when I booked in the appointment. This patient is under general anaesthesia because, as well as the cysto today, she's also having her spay. Normally we do a diagnostic ultrasound under sedation, as that's a sort of good enough level of anaesthesia. It just makes it less stressful for the patient, and also it's diagnostic ultrasound gives a better image in a relaxed patient. As this procedure requires an anaesthetic and it's a diagnostic test, this is considered an act of veterinary science according to the Veterinary Surgeons Act of 1936. In preparing this patient, I've clipped her as if she's having a spay. So if we were just doing a normal cystocentesis, it would sort of be an area around the bladder. And for a normal diagnostic ultrasound where they want to look at the kidneys, you go right up to here as if you're clipping for an X-lap, and you go right down to the ribs and all the way down here. So it would be quite a big field to provide an acoustic window into the area that you're looking at. As you can see, I've clipped this patient away from the ultrasound room. That's just so that no hair goes into the machine or affects it in any way. I've clipped the patient with a 40 blade, so it's really quite short. And this is to ensure the transducer has good contact with the skin. Because any air caught between the fur and the transducer, any air caught in the fur between the skin and the transducer will affect the image, because the ultrasound doesn't go through air. And I've also given the patient a clip just to get rid of any of the extra hair. After this, I'll then give the patient a wipe with alcohol. This cleans the dirt and grease from the skin. And then we apply the ultrasound gel. That helps the transducer with its mobility and contact with the skin. And then after the procedure, I'll wipe the transducer off just with some paper towel to clean it, and the patient's abdomen will also be cleaned, and then she'll go in to have her spay. So yeah, when using the ultrasound machine, we just need to be very careful with the transducer, as it's made out of porcelain and has crystals, so it's very delicate. You have to be careful not to break it. Yeah, so that's how we do the diagnostic ultrasound prep. Thank you.